Hey folks, thank you so much for tuning to our channel today. And today I want to talk a few minutes about anaphylactic shock. Anaphylactic shock. I want to tell you the most important things. And it's very, very important because if you miss this, somebody will die. So that's why you should know about it and provide the treatment uh, at the best of your capacity. First of all, anaphylactic shock. It happens due to increased amounts of histamine. Basically, it's a histamine reaction. So the histamine, it increases vascular permeability and the fluid goes out, and this fluid that it will tell you there is hypertension, low blood pressure, and this fluid accumulates and causes obstruction of airways. That's why the patient gets respiratory depression. So, those are the most important things: respiratory depression or failure and fluid loss. You have to address those problems. We give epinephrine. Why? Because epinephrine is treating those allergic symptoms of histamine. So that is the first step in the treatment. Where is epinephrine? How to give it? You should always learn those things. Always keep epinephrine handy. Like you can give it like an auto injector, but these auto injectors are outrageously pricey. Maybe it is time to open our market to some made in China epinephrine or some made in India epinephrine, because why would people spend $400 to $500 on EpiPen? That is not right, folks. But if you can't afford that, you can always ask your doctor to write a prescription for epinephrine ampoules. Get an ampoule, but remember these are like 1 ml ampoules, and you have to give only zero point 0.3 milligrams to an adult and zero point 0.1 milligrams to a child. So if it is coming like 1 milligram per 1 ml, you are giving zero point 0.3 milligrams, that's like 0.3 ml. So you just give that much dose. That's very important. If you give high dose, again, that is dangerous. So remember the doses. If you think you will forget about those doses, write down. What I did, I took a small piece of paper, I wrote down these steps: epinephrine and IV fluids, then albuterol, then H1, H2 blockers, and steroids, those 5 steps. Write down each one how much dose you give. One chart for kids and one chart for adults. I have these lists posted on my desk. So if anybody comes, I'm ready. So epinephrine you give in that dose. I usually give zero point 0.3 milligrams to adults and 0.1 for kids. And this comes in 1 in 1,000 and 1 in 10,000. So 1 in 1,000 is for adults, 1 in 10,000 is for children. So be careful with how much epinephrine you give. And also remember, when you give these things, be careful. One day, I gave epinephrine to one nurse, and the nurse got confused. So I always check the dose. I will take that thing again, check out. So you're giving 0.3 ml. Then you give. So always double check these things. Then albuterol. Albuterol is like, there is like these patients develop bronchospasm. So albuterol is a bronchodilator. So it dilates these air vessels and help the patient to breathe well. IV fluids, because as I said, they get hypertension, so you put the IV lines, like take like an 18 gauge and put like 2 lines, at least 1 line, and start like a bolus with intravenous fluids. Normal saline is fine. If they are kids, I use like 20 ml per kilogram, and if they are adults, I will just put a 1 liter bottle to start with, and give more fluids as we treat the patient. So epinephrine, IV fluids, and then albuterol. You can give albuterol by an inhaler or a nebulizer. Then there is H1, H2 blockers, because you see many times we just give H2 blockers, right, diphenhydramine. But even H1 blockers are good. In fact, studies have shown giving H1 and H2 blockers is more efficient than using either one of them. So use both H1, H2 blockers. Like H1 blockers, uh, I would say I will give like ranitidine and H1 blocker diphenhydramine, and that is called Benadryl. H2 blockers like famotidine, ranitidine. So give them. And then there is solumedrol, methylprednisolone, because steroids help in these patients because the whole immunity system is on fire here. We say he's on steroids, right? And to describe somebody who is acting so much. In the same way, here, literally that is what is going on. Immune system is on steroids. It's so aggressive. So to cool it down, we are using steroids. So give solumedrol. I usually give solumedrol 125 milligrams IM or IV slowly. So those are the most important steps you can follow. And always look for the symptoms. First assess them, and first screen the patients. One day I was seeing patients, and there were like 3 patients ahead of on my roster. But then one patient came in, and this patient is at the desk, and the receptionist is asking, okay, give the driver's license and insurance card, and then fill these 2 papers and all these things. But the patient was having respiratory distress. So I saw that and I acted immediately. I put these 3 patients away, and I immediately went to the reception desk and said, there is no time to fill all these papers. Come on in. And I took her into a room, and she's going through anaphylactic shock. So I immediately gave those things I told you about. So many times you don't go by steps 1, 2, 3. You always scan the room, and who is that patient who needs immediate help. So go for them and pick them out and deal with them, because here each second is so precious. So because if you do not act in a timely fashion, patients will die. So those are the points I want to tell you about anaphylactic shock. And if you have any questions, please give me an email, or just watch my other videos, and hope this will help you. Thank you very much, and make sure you subscribe to our medical videos. Thank you.